All right, recording has been started. My name is Alex Simmons. It's great to meet all of you. I'm the co-founder and CEO of Boon. I'm very grateful that all of you are here today. We have about 70 people joined so far, and a whole bunch more are on the way. So wanted to get this kicked off, but lucky to be joined by one of Boon's amazing coaches, Kim Byrd, who has a ton of experience in and around the mental health space, and it being Mental Health Awareness Month in May, we thought it would be an awesome opportunity to just talk a little bit more about some of the struggles around mental health in the workplace, and specifically as it relates to your personal and professional life. So I'm going to be passing it over to Kim and kind of letting her dig in. And then at the end, really throughout, if you have any questions about anything, feel free to throw it in the Q&A and we can hit on those all at the end. But feel free to pass any questions along as you have them. And at the end of this, we're going to be giving a brief overview on Boon and what we're all about, and just thinking about beyond sort of self-care opportunities to take care of yourself with some of the mental health topics that we discuss. How can you think about Boon in your workplace today? So here with that, I'm going to pass it off to Kim. And Kim, I'm going to start sharing my screen here and we can start diving in.
Great. Thank you. And Kate, I know some of you that are probably on this call, we have met via Zoom a few times, but to give you a little bit of information about me, I live here in Michigan. I have worked with Boon since it started, way back when in the dark days of COVID. And I've been very blessed to see clients all over the world to offer support both personally and professionally, and also able to touch base with people on these webinars that really talk about some of the things that I think a lot of us are struggling with, and maybe either don't feel comfortable talking about them or maybe don't have an outlet for them. So I'm hoping today to sort of reduce some of that stigma and give you some tools both in the workplace and at home. So when we talk about mental health today, I do want to define what it is. I mean, we use the terminology kind of freely, but I want to make sure we're using the terminology correctly. And more importantly, some of the myths out there about mental health, I think, are really important for us to address. So I want to spend a little bit of time on that, but I want to move into the idea of stress and how stress links to mental health, along with some messages that you can use not only for self-talk, but for other folks to have an outlet and have some self-care techniques to really support one another as we do and are living very stressful lives at this point. So when we talk about mental health, I kind of put some more of the general terms that I thought a lot of you might have heard in the past. Obviously, there are a lot more diagnoses. I have to work under the DSM, and I can't even tell you how many pages it is. But I wanted to just touch on the most common words we hear. So we hear a lot about anxiety disorders, and that might be obsessive compulsive. It might be social phobias, panic. Some of us are struggling with some post-traumatic stress that would fall under that anxious mind and that anxious body. For our mood disorders, we hear a lot about bipolar, borderline, depression. Some of us that live in these states that are very dark for 6 months and gray, we've got the seasonal affective disorder. And then I kind of tossed in there's many branches of disorders that would fall under the schizophrenic tree, but just to touch a little bit on that today too, so that we all are very familiar with some of this terminology and what it means. But when we think about the words mental health, what that is our ability, coping skills, sort of our functionality in life, realizing what we can and can't do and can and can't handle, But do we have the coping skills that are needed just to cope and manage with the daily stressors of life? We all have to be productive in one way or another. So when we are mentally healthy, we are very productive. But when mental health creeps in, it can affect us emotionally, psychologically, socially, physically, physiologically. So it really can affect pretty much every aspect of us. And it really affects kind of how we think, not only about ourselves, but about those around us, how we feel interacting with others, sometimes our behaviors, which we'll talk about today. So when we talk about mental health today, I want you to really think about all the aspects that are included in that. To talk about myths, oh my gosh, I think we could talk about myths for a million hours. And I know there are many people on this call that might have loved ones, friends, family that really believe these myths. And I'm hoping today we can all go out and really change those myths into facts. So a lot of folks will say, well, I don't have any mental health issues. I can't be affected by that. I have friends. I have a job. I have a family. I have a home. I can eat. There's all of these myths that mental health challenges are coming from these areas of life. And we think, well, if we don't have those, then it can't affect me. And that's a huge myth that we want to conquer because, if we think about mental health, about half of all mental health issues, challenges, disorders are onset really before the age of 14. We might not see it at that young of an age, but more than half of us have had something that has surfaced at that time. And 3/4 of our mental health population starts struggling before the age of 24. So we really want to say children can be affected. I can be affected. Any one of us can have a mental health issue at any point in our lives. So one of the myths that people talk about is that people with mental illness are very violent and aggressive and very loud and defensive. We really want to squash that. There are many people that you are surrounded with every day that might be struggling with anxiety or depression or bipolar, but it's controlled. They're taking ownership of their mental health and they're interacting with therapy, maybe medications, physicians. They're taking control of that. So we really want to squash that one. Those are the biggest ones and the most common ones I hear. And I put a little bit of some statistics on there that 1 out of 5 of us will experience a mental health condition in any given year of our lives. So that's how common any of those things that we talk about are happening to us. So as you look around your loved ones and your family members and your friends, we really want to make sure that we know how to support that person if and when they experience some of these mental health challenges. And boy, stigma, right? It goes right with the whole myth thing, but there's this fear of talking about mental health. I hear people talk all the time about high blood pressure or diabetes or cancer. But for some reason, when we start switching to talk about depression or anxiety, everyone starts kind of whispering about it and sort of shying away from talking about it as much as I would tell you about my high cholesterol. So we want to break that stigma and talk about our mental health more freely and more openly. Alex, I don't know if you switched something on the slides, but they just disappeared. Sorry, guys. I don't know where Alex's screen went. And I can't share mine, or I would. So let's get him, once he kind of comes back, we will have him bring us back up to speed on the slides, but I don't want to waste our time and not talk about the things that are important. And I really think stigma would be one of them. There's a lot of feeling of shame even when folks go to see a therapist or a counselor or their physician, they don't want to admit that they might be struggling because they might think, oh, they're going to think I'm weak, or I don't want to show emotion. It's scary to dive into those emotions and talk openly about them. Again, that shame component is such a big link to mental health. And we want to make sure that we are in a safe space to talk about that. Today, for example, is a very safe space. And you might say to me, like, how is that possible? There's over 100 people on the Zoom. Feel free to type questions in the chat. And you can either type them anonymously, or if you don't know how to do that or don't feel comfortable with that, you can just kind of click on your chat and direct your questions straight to Alex. He will then read them aloud at the end. No one will ever know that you asked me to elaborate on something or clarify something. So this particular situation is a safe space. There's ways to make our spaces safe without shame. So we want to be honest with ourselves and really explore why maybe we're not talking about things, or if someone is sharing their depression with us, we might feel a little bit uncomfortable. We want to just feel as comfy as we do when we talk about high blood pressure. So that's a little bit today what we're going to go into, and I'm hoping to give you some scripted responses that are supportive but comfortable to deliver. So when we move into stress, we talked about some of those psychiatric mental health diagnoses, right, that fall under the umbrella of various anxiety, mood disorders. But although stress is not an official psychiatric diagnosis, if we don't conquer and manage our stress, it can easily lead to increased anxiety and depression. So it can make not only our mental, but also our physical bodies struggle. So let's define stress. What is stress? We talk about that a lot. And we want to really understand what that word means. So on the next slide, I've got some general definitions about how we look at it. A lot of us throw around ideas of, oh, I'm so stressed out. But if we really think about stress and what it does to us, again, we've got that physical reaction. We can have hives, we can have rapid heart rate, we can have stomach issues, insomnia, hair can fall out, we can gain weight, we can lose weight. There are a lot of physical changes in our body if we don't address the stress. So we think about that physical, chemical. Our brains are releasing these yucky chemicals that we do not want because of stress. So we want to think about stress in a way, is it in our personal lives? Is it in our workplace lives? Start really kind of chopping that up and see where sort of the high stress areas are. If we can identify those, we can get at them a bit easier. So we want to talk about the statistics of workplace stress specifically. We've got about 83% of our workers that state they are struggling with workplace stress. And when we think about what they are reporting, it's mainly personal issues at work or the feeling of, I'm not living up to the requirements or the expectations at work. I have way too much on my plate, and I am just sort of running in circles trying to catch up and feel like a productive person. So every year, about 1 million of us miss work due to stress. So we aren't taking time off because we want to go on a vacation or we want to go to our child's event at school, but we are taking time off or we're not taking time off, which we're going to talk about in a minute, how stress can affect us if we do not take time. But 1 million of us are taking time because of stress. So if we are able to manage that, then our productivity will be much, much more. We might want to say, well, how do I know that my workplace is causing me stress? So the symptoms of workplace stress that we're looking for are when you're at work, maybe you're a little more agitated or bitey or maybe irritable, and you're responding to folks like you've never responded to them before. Maybe you're withdrawing a little bit. So for some of us who are chatty in meetings, maybe you notice that a coworker who is normally fun and friendly and all of these things in meetings and engaged really isn't saying much. And people will say to me, well, I'm living in a Zoom world now, so how am I supposed to know if my coworkers are struggling? Watch their body language. You know them well enough. How are they acting now versus how were they acting maybe in the past? If it's friends and family, you might have, obviously a little more open dialogue with them. You can see them in real life. We're seeing a major increase in alcohol use on the daily. Again, thinking that is a coping skill for stress. A lot of my clients and I talk about sleep routines. They're so important just for your overall mental and physical health. But when we don't identify our stress, we can be in a very bad hamster wheel of insomnia, not sleeping through the night, which of course then leads to us the next day being at work, feeling these irritable or exhausted types of feelings. Our focus is off. We might have a huge project due, but we don't have the ability to concentrate and focus on it. So these are some of the things I want you to sort of pay attention to about your body, maybe as you move through next week at work or at home, wherever your stress is. What we worry about is this prolonged stress, right? This feeling of always having to be on and always having to be perfect. That feeling of delivering perfection. Now, whether that be in your workplace, you want to be the perfect friend, the perfect partner, the perfect mom or dad, that level of expectations of perfection that we are putting on ourselves can be very, very harmful. Think for a minute, maybe just take today. It's 1:00 here in Michigan, but maybe for some of you, it's even later in the day. Think about what you've said to yourself today. What has your inner voice told you about you? Are you living up to what it's telling you? The other side of that is it telling you something that's actually realistic to accomplish? Or is it telling you like you need to do all 100 things on your to-do list by 4 p.m. today? We are very mean to ourselves, unfortunately. And that perfectionism, those negative self-talk sentences are actually a form of self-abuse. That can lead us down a very negative, anxious, depressed mood world. And we really have to be alert to ourselves in order to catch those. Some of us are in such a bad habit of negative inner voices that we're not even realizing we're doing it. So I challenge you to think about just today and have you talked negative about yourself to you? If you have, write it down. What did you say to yourself? Look at it. Wow, I could have really changed this sentence to be something that's a little bit more positive or a little bit more supportive, or hey, I didn't need to say that to myself at all. So we've got some Zoom polls in our presentation today, and it really is helpful for all of us to share kind of where we're at, because I think a lot of us are in the same struggles. So our first question is, how often does your performance at work or home suffer due to your challenges with stress? Whether you're identifying those stresses or you're not, how often do you notice? All right. So about half of us on this call, which would be about 50 of us, are experiencing extreme challenges that affect our ability weekly to either feel functional, accomplish things, feel positive and good about ourselves. About 20% of us are daily. Okay, so I can't vote, but if I would have voted, I would have said daily. When I said this to you about identifying some negative self messages you've told yourself, I've got to tell you, I've probably told myself 2 already. And again, it's only one, a little after 1. So we really have to monitor ourselves and say, why are 50% of us feeling so stressed that our challenges are really limiting either us professionally or us personally? Switching more chemically, I want to talk about how stress can be addicting. And again, this is going to be for you to tackle. But when we are stressed, our brain releases a lot of chemicals, yucky ones. We don't want them, but it does what it does. A lot of us need to admit or acknowledge that maybe even though we don't want to feel that stress or that release of those brain chemicals, we are almost addicted to them. Now, when I say that, I don't mean you think about this and you are doing things on purpose. It's more of the subconscious response to finding stress. So we think about what it produces, right? Cortisol is that yucky chemical that we don't like. But stress also can cause us to be in fight or flight. Fight or flight is great. I'm walking down the street, it's nighttime, I feel a little bit scared. I either need to fight or I need to fly over it and get some help, get some support. But we aren't meant to live in that fight or flight stage all the time. A lot of us have been living in it. That is that unhealthy, almost addiction to stress. So the challenge is can you stop engaging in behaviors that are chaotic or events or seeking out that chaos? Are you saying yes to things all the time? Should you challenge yourself to say no to something? Are you really equipped next Tuesday to handle soccer snack? You know you have a big project due, you've got to run kids all over the place, and now all of a sudden you have to stop at Sam's Club and buy 97 Rice Krispie bars. So maybe you should say no. Think about the yeses in your life. Are there maybe 1 or 2 that you can change to a no? That right there will reduce some of that stress chemical that's being released, and you will feel mentally and physically that change. I don't know how many people on here have time to be bored, but I'm using the word bored a little bit differently. Do you feel blah or lazy or just kind of blobby if you're not under stress? That's a great question to ask yourself. If you're just kind of sitting around and you kind of feel content or calm, if you notice yourself amping up and trying to figure out, like go empty the dishwasher, do the laundry and dust and vacuum all at the same time, that means that you're kind of seeking that stress. It begs you to say, am I addicted? Do I know how to just sit here and be content? We've got to challenge it because our feelings sometimes can be dependent on that stress release. So when we think about stress versus burnout, which burnout is a huge problem in the US. It's costing companies millions of dollars. But when we think about stress, we're already thinking, okay, I am overengaged. Remember, you're just signed up for Rice Krispie Treats next Tuesday. Maybe you're a little bit irritable or bitey at work, right? You're kind of like, on edge. You feel kind of blah. Maybe physically you're getting some of those stomach aches, the tension headaches and things. We know that could be in the stress category. What we also know is that we can address those feelings. We can explore, which we're going to later today, what techniques can I put in place to address that stress? If I don't, here we go. We're going down the burnout road, right? The fatigue that comes from burnout is much different than the fatigue that comes from stress. So when we think about it, we almost become disengaged. We talked a little bit about socially withdrawing. Disengagement is even bigger. You are just sort of in your own bubble. You don't really have strong emotions either way, sad or happy. You're just kind of there. You have no motivation to do much of anything. And you feel like you're in this place of helplessness. Like, I don't know how to get out of here. So I think about burnout in a way that is, you just keep going and you're just doing the motions, but you really aren't there, if that makes sense to some of us that are in burnout. We're doing the best we can. And maybe others around us might not feel like we're at that burnout phase, but we know we are. We are just feeling like we are going through the motions. So, am I experiencing burnout? I think it's important for us to know if I am. We think about stress. If we're not identifying it and working at it, then we're going to go to burnout, all of us. No one's safe from this burnout leads to other mental health issues. And it's not going to go away on its own. So we have to face it and we have to talk about it, even if it's uncomfortable. So we have to think about why. What's causing me? Remember earlier I said, I challenge you to make a list. It could be work, personal, any area, but maybe I'll say the top 3 stressors. Now, I know this changes weekly. Sometimes I'm extra stressed about work. Sometimes I'm more stressed about my kids. Sometimes I'm more stressed and I don't even know why. So we've got to take this week. What are your top 3? We've got to identify what they are so we can get at them. If we just say an overall of, I'm just stressed, that doesn't help us. So we have to look at that. The 2 things we've talked about today are on there. Are we a people pleaser? Are we saying yes to everything because we want to please others and ignore ourselves? That's a big one. And again, that daily thought pattern. Are we speaking negatively to ourselves? Are we in this negative pattern where we've almost forgot how to be nice to ourselves? So we've got to think about burnout in that way, and hopefully we'll be able to catch it before it gets there. When we think about workplace stress, right? We bring up workplace stress a lot, especially with Boon Health, right? We talk about how can we catch this stress? How can we put some techniques in place? How can we tell someone that we need some support? And we think about maybe, I don't know if I want to tell my boss or HR or people at work that I'm to the point of stress or burnout. Because they might not think I can handle my workload. They might think that I'm weak. They might think that I'm not trying very hard. So instead of just saying, I'm really sick of this job, I know we've all said that at one time or another. Why? Remember the last slide, we're identifying what's stressing us. We need to be specific. I feel stressed because I have way too much on my plate. I've got 6 projects due. I've got a kid graduating high school. I've got jobs to do for people. I volunteer way too much. So identify what is it, so that when you talk to somebody about it, you can tell them. Be honest, take some accountability. If I've been irritable, I've got to say like, hey, I know I've been a little bit edgy lately. I'm really sorry, but I've got so much on my plate. what do you do when you feel this way, right? Be honest with yourself, take that accountability, but own it. If we don't address it, how are we going to get out of it? This works too for couples. I do a lot of couples counseling, and a lot of folks will just say these generalized statements. And right, it creates friction in our partnerships. So get specific, use those I statements. I feel sad because, I feel stressed because. You've got to start those sentences with an I, not a you. You stress me out. Think about how defensive that would make somebody feel. So these are some examples that you can use. I put work ones on there, but I definitely could put a lot of personal I statements on there. But let's say somebody at work comes up to you with some of these statements and you think to yourself, boy, I'm not a therapist. I have no idea like how to support this person. We want to really think about, this person is opening up to us. That's a big deal. So we need to make this a very safe space. Let's go talk outside. Let's go talk. If you have an office, you can close the door. Let's go talk in my office. Your only job is to be an ear, because some folks just need to vent. If someone asks you for guidance, ideas, or support, then you can feel free to share some of your thoughts in a very calm, non-accusatory way. I don't know why you're having such a big problem. I have 6 more projects than you do. Again, we're not doing that. We are talking about what's going on. Tell me more about this. I'm listening to this person talk to me so that I know what areas they might ask me for help. My nonverbals have to be open. If I'm like, oh God, this person's just complaining, my nonverbal is going to shut them up, and then they are not going to be opened anymore with anyone. And that's what we don't want, right? If we don't address that stress, look at all the things it's going to lead to. So you want to make sure that you are providing that welcoming environment. I know it's scary. If someone is telling you something extremely serious and you might not know what to do with that information, it's okay to say that to that person. I don't know how to help you, but I know that I can find resources to help you, and maybe we can look at those together. That's all it takes, is just that sentence and Google. So when someone might be telling you something that's a little bit more serious in the mental health realm, don't feel pressure to fix it. You don't have to fix anything. You're there to be an ear. You're there to work alongside that person to find help, to find the appropriate people that can talk through some things, that are trained in that area. So right now, I would say maybe half of my clients are struggling with workplace instability. And I don't know about your companies, but the layoffs are flying around like crazy. People are living in fear. They go to work scared. They sit here scared. There's a closed door meeting going on over there. I wonder if they're talking about me and my job. Then you start delivering messages to yourself that increase that stress. And that's not what we want to have happen. So we really need to identify, are we having reality in the workplace? Those people talking over there, I doubt they're talking about me. I'm nobody. I'm just over here doing my work. They're probably talking about bigger issues than me. That's probably accurate, but we tell ourselves the inaccurate, negative message. So I don't know about your office, but when it is a stressful place of layoffs or job title changes or promotions and things like this that are kind of not happening a lot in a lot of our workplaces, there's a lot of gossip. There's a lot of toxicity. It's very easy for us to get wrapped into it. I think the problem with that is we have to be selfish and say, is this healthy for me physically and mentally to sit with this person and talk through these very, assumptions, statements that aren't made with fact. and believe them and feel them. If we don't know that they're fact, why are we letting them come in and have us feel them? I've got to put up boundaries, right? I've got to say, Susie's really, really, really negative. I think it's probably coming out of fear. I don't know, but I don't want her fear and her anxiety to come in here. I got enough of my own. So I've got to put up the boundary of kind of distancing myself in those moments where someone might be saying some really negative self-talk. Boundaries are a huge thing if we're dividing workplace with personal life. I can be work Kim, but I really, really need to stop work Kim and be, I'll say mom Kim. I need to stop and go be mom Kim. And if the minute I start looking at my work email at 9:30 at night is the minute I click over back to work Kim. Now remember, we're taking a break from her. I already did her for 10 hours. Now I want to be personal Kim. So the boundaries you set for yourself will really dictate your emotion when you wake up in the morning and have to start work over again. A lot of us have really poor bedtime routines, so we want to make sure we really put those boundaries in place. So I want to click over to self-care, and we want to talk about some specifics with self-care. But before we go into that, right, self-care is something that we do for ourselves to feel good. So before we go into specifics, I really want to know, how often do you practice self-care? All right, let's see what we've got here. Oh my gosh, you 21% are fantastic. I love it. 27% weekly is awesome. That is great. Our monthly and our rarely, folks, look at our rarely numbers, guys. 30% of us rarely take the time to make ourselves feel good or give ourselves a break. So let's move on, and I'm going to really focus on the monthlies and rarelies, because we really need to figure out why we are not doing it. A lot of times people will say to me, well, self-care is selfish, and I don't have time for that because I got to help all these other people around me. When we think about it like that, objectively, it doesn't make sense, right? We've got to take care of ourselves first. But what I notice a lot of folks doing, and again, it's because of technology, is having their notifications on. So 9 p.m. across my phone screen is going to become notifications from my work email. I don't need to answer those, right? I've set the parameters at work that I will only answer emails until 7 p.m. unless it's an emergency, then you can call me. But a lot of us don't have jobs that are emergencies. So if I see that notification come up, I'm probably going to look at the email, right? And then I'm switching back to work Kim. I don't want to be there. You've got to figure out, how can I dumb down this constant being on? A lot of times people feel guilty for that. And they feel guilty because they're like, well, I'm not doing my best then. I'm lazy. I'm letting my boss down. I'm only awesome if I'm super productive all the time. We've got to separate our self-identities from those negative words. So I challenge you to turn this weekend, right? We're coming into the weekend, to turn off your notifications on your phone. So you don't see when you get a work email. You don't see when you get a Slack message because it's Saturday at 3 p.m. Try it. I know it's going to feel uncomfortable, but we've got to start putting up those boundaries. I'm going to talk at the end here about emotionally detaching. And I don't mean it in a way that you turn into blobbiness that we talked about before. But we really need to think about ourselves, our relaxation, our self-care as an investment, and not only ourselves, but everyone around us, right? So I'm thinking about that as a recovery time for me. When I go for a walk, that's my recovery time. I've got to think about, if I don't do that, how am I going to be towards myself and towards others? So if you're a leader in your company, think about mirroring. your employees are looking at you. If you're never taking a day off, if you answer emails at noon on a Sunday, you're setting the tone that they should be doing the same thing. So take ownership of that. Maybe set the email to go out on Monday morning at 8 instead of Sunday at noon. We've got to separate ourselves from work and home. We've got to emotionally detach from work in order to be the most successful we can be at home. So in summary, I really want to think about our goals, right? We have to identify the stressors, and then we have to figure out how to recover for them. Because if we don't, we're going down the bad road, right? So let me tell you, I'm going to acknowledge, maybe I'm not burnt out, but I am stressed. I'll tell you 3 reasons why I am. I've identified it. I've said it to myself, like, I'm a little bit over the top here with my stress. What am I doing? There's a lot of folks that do intentional calendar setting, and I love that because it's putting in 10 minutes, just 10 minutes once a day. That's how we start. We start mini. And in those 10 minutes, we've blocked off our calendar. Nobody can schedule a meeting with us. And it's not 10 minutes to do your work that's laying on your desk or on your to-do list. It's to physically move away from your desk, go outside, go get the mail, go for a walk around your office building, go get coffee, something physically to disengage you, even if it's only for 10 minutes. That will do wonders for your mental health. Right? Remember, you guys are also going to practice saying no. Next week, I need you to say no to something. I know it can't really be work stuff, but it probably can be personal stuff. And taking that moment to step away and say, I'm work Kim versus home Kim. So, how are you going to take ownership of your self-care? Because it's really up to you. I can give you a ton of tools, right? I can share with you how it works for other folks, but until you acknowledge that you need it, it's not going to happen. So to finish this out, I know you're sick of my polls, but I really want you to take the ownership. So I've listed the most common things that I hear my clients say that they're going to put in place, but what about you? What are you going to put in place? Remember, we talked about bad sleep, going to bed habits. Scrolling on that phone is probably one of the worst things you can do right before bed. Our brain is stimulated and ready to go, and then we put the phone down and we expect it to go to sleep. Can't do that. So is it sleep and nighttime related for you? Is it your social interactions? Is that what your stress is from? Or is it work? Are you just overloaded, and are you not giving yourself permission to take 10 minutes? So tell me what you think. What are you going to put in place that might be helpful for you? All right, I love intentional calendar setting. It's perfect. You 4% that are going to get up early for work, I love you. That's amazing. I'm just too lazy in the morning. I do it at night. Walking on a lunch break is wonderful. We've got a lot of folks that need to develop a new sleep routine. That mindless sleep schedule that we are all on really needs to be more structured. And I really see a benefit in my clients once they kind of stick to a routine for even 5 days. They really feel a difference. So we've got some great ideas, but the challenge is to implement them. And I'm really hoping that you guys will go away today and at least implement one thing to address that stress, because I don't want it to accumulate and turn bigger. So I thank you so much for having me. I'm more than happy to answer questions or elaborate on things that might be helpful for you.
Awesome. Thank you so much. And apologies for the technical gaffe. Apparently, 3 years into COVID, we are still having Zoom challenges, but made it through. Appreciate everything, Kim. We had a few questions here. We had one question just around maybe just quick strategies or tips for separating work from home when you are working from home, which a lot of us are doing today.
Yes,
Sounds a little
right.
bit more challenging.
Oh, that's a tough one. I am at home right now. If I work from home, I actually have a morning and an afternoon calendar setting, 10 minutes where nobody can reach me. And I actually physically get out of this room. I am usually in the summer, I go out and I deadhead my flowers. I have to pick up dog poop a lot. I got dogs. I go for a walk just to the mailbox. Again, it's only 10 minutes. It's not a lot of time, but I use it to benefit me. I don't use it. I have a lot. If you saw my desk right now, I've got a lot of piles I've got to work on. I don't do it during that 10 minutes. The other big thing I do is notifications. I stopped sending my work emails to notify me. They're still coming. I can still see them if I go into Gmail, but the notifications for me have stopped. I have noticed my anxiety decrease a lot at night and especially on the weekends, just not seeing that flash up on my screen. We've got to be more intentional if we work from home, because work Kim and mom Kim are in the same place. So make sure you're physically changing where you're at and move your tush out of wherever you are, because that's the only way that we're going to kind of break that brain pattern of like overstress, overwork.
Yep. Get up and move.
Mm-hmm.
Always the best advice. This is an interesting one. I found that my personal stress has been temporarily removed. When my personal stress has been temporarily removed, my work stress has increased. I work in a team that most of us keep taking things on. I find myself taking on more and more because my other stressors are not there to manage.
Whoever asked that question, can I challenge you to look back on that "Am I addicted to stress" slide? It might be something you are doing that you're not even noticing why you're doing it. Are you saying, I know the workload is high for us, but I'm wondering if you are starting to feel a little more calmer. Are you seeking that stress hormone release? You would be surprised at how many of us are addicted to stress and we don't realize it. So I guess I would really challenge you to look back and question yourself on those addiction feelings. Am I trying to find more to do? My home is pretty calm. What kind of mix can I get into to bring me back to feeling stressed? Because when I feel stressed, that means I'm doing stuff and I'm feeling productive and I'm getting things done. You're going to still feel that way, even if both places are calm. But it takes us to challenge ourselves to find that feeling.
Yeah, that's actually a great point, Kim. And I guess maybe just like a parallel question to that is there some of that addiction to stress driven by our own internal feelings of inadequacy and feeling unsatisfied with our job performance?
Right. If we're connecting our identity to our jobs, that stress increases a ton. I think it was like 46% was the last article I read. We've got to separate it. My work performance, although important, right? I need money, I need jobs. I like my jobs. I want to do well. I like my bosses. I want to do well for them. But if that striving for perfection is constantly there, think about how that will wear on you in other settings of your life, and physically and emotionally, obviously. So we are seeing a lot of folks that are connecting the two. My identity is this instead of being my identity is that. You know, what are your hobbies? What are your passions outside of work? Think about those. That's who you are. You have a professional side, obviously, but that should not be how you define yourself. And the minute you can set that boundary in between, you do start feeling a decrease in stress on that side of things.
Sense. We had somebody ask if we can listen to a replay of this. Absolutely. They joined a little bit late. We're going to be sending a follow-up to everybody who's here right now with a copy of the presentation and just a copy of the recording. So don't worry about that. And ultimately wanted to leave a couple minutes just to walk through Boon really quickly and give everybody a chance to ask any questions they had there, because I think, you know, a lot of the stuff that Kim is talking about today, while it is super beneficial in terms of tips and strategies from a self-care perspective, just wanting to understand a little bit more about the types of resources that you have around you in your workplace. So this webinar is specifically available for our customers, Boon's customers. So employees of those companies all have access to Boon. And if you happen to be on this webinar that does not have access to Boon, that's okay too. You can just learn a little bit more about what we do. And essentially, just from a high level, hearing Kim talk, it just really rang true to a lot of what I feel on a daily basis, where I'm the co-founder and CEO of Boon. And a lot of what I deal with is daily stress and anxiety and sometimes burnout. And a lot of that has to do with how can I be a better leader? How can I better empower my team? How can I grow Boon more quickly? How can I deliver a better experience to our customers? All of those things. And I think what we've really found at Boon is that there's become such an intersection between personal and professional. And that's really what we're all about providing support for, and ultimately guiding you towards being your more resilient self. So in addition to all of the self-care talk that Kim was talking about, Boon actually is a personalized one-to-one coaching platform for employees where you have access to 30-minute coaching sessions every month, 2 times a month. It's 100% confidential from your employer, and it's sponsored by your employer. And I think, as Kim was talking about, here are some scripting messages that you can say to your employees and around, if you're seeing stress in the workplace and those sorts of things. And those are like amazing scripting techniques to be able to take back into your workplace. I think something that we found is that regardless of all of the scripting, a lot of people simply are not that comfortable speaking to people who are in their workplace about these sorts of challenges that they're dealing with. So what Boon is providing is a third-party, non-judgmental outlet for you to be able to talk about what's going on in your life, personally or professionally. So we're really here to be a safe space for you, whatever you're going through personally and professionally. This is obviously a more mental health focused webinar, but what we found is that a lot of people are looking for support from a professional setting as well. So whether it be, coming back to work from maternity leave, or more leadership development and trying to become a better leader in the workplace, time management and productivity, wanting to become better with your presentation skills as a leader. These are all things that contribute to stress and anxiety on a daily basis, but they might be a little bit more professional in nature. So our whole idea is we want to support you personally and professionally. And you see somebody like Kim, if you're looking to work on something that's more mental well-being oriented, we would be matching you with somebody like Kim, who's a master's levels therapist, has that in their background. Whereas if you're looking to work on something more professional in nature, we're going to match you with a coach who has more, 10 to 15 years of corporate experience, whether that be HR leadership, C-suite background, learning and development, operations, you name it. And they're certified as a coach through the ICF, which is considered the gold standard in the coaching world. So personalized to your needs, whatever you're looking to go for, personally or professionally. And it's super easy to sign up. I'm going to put a link in the chat here, but there's literally a 3 to 5 minute welcome survey that you complete. We get some basic information on your background, your role at the company, how long you've been there, what sorts of challenges are you looking to work on? Is it more personal, professional? What is it? We send you 2 coaching options. You book right then and there. You're able to book within 24 to 72 hours. So super quick turnaround. Everything happens in Zoom. So it's very streamlined and easy to use. And then from there, you have your relationship with your coach. So this is what the coach matching email looks like. And ultimately it's just super easy to use. And just wanted to answer one quick question or a few quick questions that we typically get is like, what if I don't know what I want to work on with my coach? This is something that we typically hear. That's totally normal. 50% of the people who are working with Boon today have never used coaching or therapy before. This is their first time talking about what's going on in their life in certain ways. So you don't have to have it all figured out. Your coach will help you find that. And ultimately, that's totally normal. So you don't have to have it all figured out. You're able to switch coaches if you don't feel like you got the right fit. We're always going to make sure you have an amazing experience. We're personalizing it to your needs in a lot of different ways. Your role at the company, what you're looking to work on, how does your preferred availability line up, all of those different things. But ultimately, those are some of the frequent questions that we tend to get when we kick off Boon. And I'm seeing I'm seeing here, oh yes, Boon process is easy, and I love my coach. Love my coach. She helps me tremendously. So thank you for the shout out. I appreciate that. And I'm going to send a link to our welcome survey just in the chat right now. And ultimately, you all can take this directly. And if you just look in the chat, you can see a link to sign up for Boon if you're interested. If not, we're going to be following up with a follow-up email here with a copy of the presentation and the webinar. And ultimately, this is Mental Health Awareness Month. Boon is on a mission to destigmatize mental health in the workplace and really talk about this intersection between mental health and professional development, because I think what we're really seeing in the workplace today, particularly through COVID with remote work and hybrid work settings, somebody asked the question about separating your work life from your personal life. It's very difficult to do today. And so our whole idea is that personal and professional have become more integrated than ever before. How do we think about these things holistically? We want to be your one-stop support system for those things. So looking forward to working with you all and appreciate your time today during your busy weeks. And thank you so much, Kim, for an awesome presentation. I always learn a lot, and we'll talk to you soon, but we'll follow up after this. Thank you so much. Take care.
Thank you.